Easter time now. It is the third most common illness in the world, but experts say there's still not enough being done to help people with migraines.
Every day in the UK, there are around 190,000 migraine attacks, and more than 3/4 of sufferers experience at least one attack each month. Health campaigners say that migraine remains undiagnosed and undertreated in at least 50% of patients.
The first Migraine World Summit now taking place online with us, Ian Watmore, chairman of the Migraine Trust, Fiona Lancaster, who started having severe migraine attacks 2 years ago. Welcome to you both.
Hello, good morning.
Fiona, can you just first of all, for people who've not suffered a migraine themselves, just tell us at its worst, what is it like for you?
At its worst, it's very debilitating. I can lose control of my speech, my limbs. I can lose consciousness at its actual worst in a migraine attack. The unpredictable nature makes it very bad because you can know your triggers, but you can control as much as you want, and sometimes something like the weather can be a trigger. So you can control your caffeine, you can control what you eat, you can't control the weather, so it is very tough. I mean, I take tablets every day to prevent them. I still have a migraine every, say, 5 days on average.
See, Ian, anyone listening, whether they're migraine sufferers or not, and we've had some viewers comments on what they're going through as well, would just be so frustrated that it doesn't seem that there is medical help or something concrete that can just get rid of it. It's debilitating. Losing consciousness through a headache. I mean, that just is, it's just not acceptable, is it, that we should be going through this in a day of modern medicine?
Exactly. I'm a sufferer myself. I describe it as like having a red-hot poker thrust through your brain and twisted for good measure. It is so agonising when it happens. It's so different from your average headache that a lot of viewers will get on from time to time. And I stumbled my way through the system. The system doesn't help you. There's not enough training. There's not enough people who can really help. And it was only the charity, the Migraine Trust, that I found that pointed me in a good direction. They helped me, and the doctors that I got through them
So you went through the specialist care, sorry for interrupting.
Absolutely. And then I ended up, joining the trust, and now I chair it. So it's kind of a good circle for me personally to be able to help. I see stories like Fiona's so often, and the World Summit that's going on at the moment is showing this isn't just a British problem. In fact, we are probably one of the better countries here. The world at large is just treating this condition with negligence and lack of respect. And
So, Fiona, I don't know whether your case is unusual as much as relatively recently, 2.5 years ago, you were diagnosed, and that's when it really kicked in. But before that, there have been signs that you didn't link, but the experts are now telling you were linked to your later condition.
Yeah, you can look, I suppose, hindsight's always a wonderful thing. As Dr. Silver, who we spoke with earlier, was saying, some of the signs maybe were there, but were possibly overlooked. Like restless leg syndrome, I had been, maybe seeing my GP and with niggles of, I don't feel I'm sleeping well, I'm having sort of mild niggly headaches, I'm waking up feeling like my legs have been running a marathon. And I didn't really connect that to being a migraine or anything like that. I thought this is just, I'm not sleeping right or something's disturbing my sleep, but I never in a million years would have said I'm a migraine sufferer.
Ian, what would you say? I mean, Elaine has told Breakfast she's been diagnosed with chronic migraine, headache every day since November 2014. She's made lifestyle changes, very rarely took painkillers. Simon says when he was young, he suffered migraines but was never diagnosed. He felt as if the ceiling was on top of his head and the shoulders crushing down on me. When people are suffering like this, what would you say to them? They've been to their GP. Obviously, they may have even had specialist help, but the medication isn't there to stop this.
Well, there are medications that do help, and that's certainly one thing that I discovered by my journey. You have to keep pushing and trying to find the ones that work for you. Some of them are designed for migraine sufferers. The vast majority, it's an accidental byproduct of something that was used for something else. I mean, even Botox can help, and it's now on the NICE guidelines. But most of the drugs that people take are for other things, antidepressants or beta blockers or things of that. I've tried a lot. The only thing that works with me is something called sumatriptan, which is a type of drug that you can now get in the pharmacy. So there are out there, but the lifestyle changes and research is what's really
Can I just ask Fiona as well? I mean, someone out there listening to this morning might think, I'm hearing what Fiona's saying. That's a bit like me. They go and see the GP. What do they say to the GP? Do you demand? How do you make sure you get the right attention?
I did have to really push with my GP. I was originally referred to ENT. They thought it was vertigo. They thought it was connected to an inner ear infection. I pushed to see a neurologist. I was told that this was stress, and I said, look, I know my body. I know my stress levels, and I know this is more than that. And I did eventually see a neurologist who diagnosed me. I think it's very important to be adamant and to know if I had realised that these other symptoms could have been connected, I would have pushed much sooner and got that diagnosis sooner.
Thank you very much for sharing your story for us, Fiona. Thank you, Ian,
Thank
as
you
well.
for having me.
And for people there who are suffering, migrainetrust.org is the place to go. It's got all the
I
information.
find them to be very helpful.
So, thank you very much indeed.